Hello, my name is Dustin Westfall. I am a cardiovascular intensive care registered nurse, and I'm here to introduce my policy proposal of telehealth healthcare services that are overseen by family nurse practitioners in Florida. Health disparity is the differentiation in health outcome that is correlated with disadvantages pertaining to one's environmental, social, and financial circumstances. Florida is currently the fourth most populated state, has the highest segment of residents aged 65 years and older, and is challenged with disparities in health and healthcare access. The need for a policy to aid in providing care for these areas throughout the state is imperative. It has been shown that people who live in rural areas with a lack of health care often suffer from greater health-related issues and mortalities when compared to the overall population. These individuals have shorter life expectancies, increased occurrences of chronic and preventable diseases, and more common disabilities. A main obstacle to health care in these rural areas is a shortage of medical providers in these regions. By having FNPs run telehealth services in these areas, access to medical providers will be attained and independent practice for FNPs will be endorsed. The proposal will not only aid with the issue of health disparity, but could also help with the financial considerations regarding healthcare due to using FNPs over physicians for medical needs. Autonomous practice for FNPs should be encouraged because the impact of the nursing profession and education will be seen. Currently, FNPs in the state of Florida work under a restricted practice, which entails the FNP working primarily under a physician. In order for this policy to take effect, Florida will need to adapt to FNPs having full practice benefits, which permit FNPs to assessing patients, diagnosing, ordering tests, supervising treatments, and prescribing medications. The standard of full practice is not only recommended by the Institute of Medicine and National Council of State Boards of Nursing, but is practiced in 23 other states. Telehealth has been utilized in different ways in the healthcare industry, and studies have shown promising outcomes for its usage in rural areas. It was determined that telehealth is able to successfully overcome the barriers of serving isolated areas and provide efficient healthcare to people. A cost analysis that was conducted in 2014 showed the financial impact that would occur if more FNPs were used for primary patient care. The state of Alabama, for instance, was used for the study because it currently does not allow full practice for FNPs. The study showed that by changing the state's restrictions to full scope, increased employment would occur along with the state saving $729 million over a 10-year period. Health disparity in Florida is a continuing and growing issue in this state. It is one, though, that can be further addressed and aided with the implementation of telehealth to these rural areas. By allowing FNPs to oversee telehealth in these regions, health improvements throughout the state would be attained, and the state would see the financial benefits of allowing full practice for the FNP. This policy is one that will not only benefit the patients, but also Florida's health industry and model. I know it can be a positive impact on the healthcare in Florida and change healthcare as we know it today. Thank you very much.